Welcome to Health Matters, a show about what matters to your health for all citizens of Worcester and Central Massachusetts. Health Matters is a collaborative effort of WCCA TV, the People's Channel, as well as the Worcester District Medical Society. My name is Jay Broadhurst. I'm a family doctor here in Worcester, and I am the host this evening. And we're going to be focusing on breastfeeding in the Latina community. There's actually much more to it than that sort of title suggests, but I want to welcome two friends and colleagues. To my far right is Dr. Sara Shields, another family physician, has been practicing in Worcester for
28 years.
28 years. Holy cow. Wow. And Dr. Shields is a member of my department, or our department at UMass. She is also the chair of the Worcester Healthy Baby Collaborative and is active with the Worcester REACH grant, which is connected to the Healthy Baby Collaborative. And to my immediate right is Ydalia Heimann. Ydalia is a member of the City of Worcester Division of Public Health and is the REACH program manager.
Yes.
And since we've been talking about REACH and a grant, I was hoping, can I call you Ydalia? Is that okay?
Of course.
All right. I was hoping that you'd be willing to tell our audience a little bit about the background of this REACH grant and kind of what it's about kind of broadly, and then we'll get into more of the breastfeeding specifics.
Of course, sure. Thank you for the opportunity to inviting us to use this platform to arrive to our community. REACH is a racial and ethnic approach to community health, and it is a grant under CDC, Centers for Disease Control. And this grant is to address health disparities among populations. And we are working specifically with the Latinx population. Mm-hmm. In order to implement this grant, we work with 5 different strategies, which are food systems, nutrition standards, community clinical linkages, physical activity, built environment, and breastfeeding, which is the strategy why we are here today. So this is a grant that lasts 5 years, and we have 41 recipients nationally taking advantage of this opportunity to work with our community. And we are in the last stage of the grant.
I see.
So it's 5 years. This is the last stage, but we are in the process of applying for another 5 years. So hopefully we will be able to continue working with our community.
Wonderful. Dr. Shields, and maybe I can call you Sara, is that okay? How does could you tell us a little bit about the Worcester Healthy Baby Collaborative and how that interfaces with the REACH initiative?
Sure. We're an organization it's an umbrella coalition of health professionals, public health people, and community agencies looking at trying to reduce infant mortality in Worcester and focusing on, the health of young families and their parents in the first year of life in particular. And so 5 years ago, we worked closely with the Division of Public Health, and 5 years ago they came to us saying we'd gotten this grant and would we be willing to look at breastfeeding support in the community. Our past work had really tried to listen to what the community was asking us to do, and we got involved with the Baby Box Project, now known as the Safe Baby Project, because of the community sort of voting for us to do that. We hadn't heard about breastfeeding as a need in the community, but we said, sure, we'll help out with this grant, and it was really eye-opening to realize the need is really there, and it's been a great opportunity to increase some of the resources for the community.
And my understanding is that historically, Worcester has not done particularly well in terms of infant mortality and perhaps even maternal morbidity and mortality, or and teen pregnancy as well. And are those all parts of this puzzle? That, I mean, how do you help a community make sure that babies can be healthy?
Well, that's a good point to connect it with these other issues that we know about in Worcester. And I think we know that breastfeeding is the best thing for an infant in terms of the healthiest way for them to be fed, and it helps reduce certain outcomes for them, helps prevent sudden infant death syndrome. So it's part of a safe sleep strategy, which goes along with our Safe Baby project. So as part of our project, we had already been promoting breastfeeding as part of that.
I see.
Teens are certainly at risk for maybe not breastfeeding as successfully just because of education and opportunity and all of that. And so that would be a piece of that. And we also know that with Worcester's amazing diverse communities, that there's different rates of successful breastfeeding as defined by the family themselves, as well as certain numbers that we look at as public health people, like duration of exclusive breastfeeding or duration of any breastfeeding, and those numbers are lower among families of color in the United States in general, but also in Worcester.
Also in Worcester.
Yep.
I see. Ydalia, when the grant came into being in 2018 and you connected with the Healthy Baby Collaborative, what was the kind of the state of breastfeeding in different communities in Worcester? What was the issue that led our grant application in Worcester to include breastfeeding as a target intervention, something that needed attention? What was going on?
I was not with the DPH by that time, but I can tell you is that when we submitted the application for this grant, we look at the data. The data were telling us what is happening here in Worcester, what we needed to do in order to address health equity. And we noticed that breastfeeding is very important. In fact, that's where everything begins. Okay. If our children are healthy, we are going to have a healthy community. Yep. So this is how we end up selecting breastfeeding as one of the strategies to implement in the city of Worcester.
And were there disparities that the data showed between different communities and rates of breastfeeding or duration? What were the things that led the city to say we need to intervene?
That data back in the States and the decision made, I was not part of it, as I mentioned before. But when we talk about the Latinx population, right. Okay. We know that they are in the number of people that are highly affected with chronic diseases, including breastfeeding. So this was the decision made based on the Latinx population within the city of Worcester, and it's the largest population among the minority.
I see. Sara, perhaps you could, from a kind of physician perspective, talk a little bit about why breastfeeding is important and what happens, generally speaking, what sort of defines success in terms of breastfeeding, and where are things falling short, and what kind of interventions can help get things to where they need to be?
Sure. I think breastfeeding is good for babies. It helps prevent infections. It helps encourage bonding with a breastfeeding parent. And longer term, it's been associated with better health outcomes like lower rates of obesity and less things like diabetes, and also helps the mother in terms of reduced risk of breast cancer and some of the other potentially helping with the birthing person's obesity rates as well long term. So it's got benefits for both sides of the dyad. What we do know is we want people to meet their breastfeeding goals. And if you ask people, most people know that breastfeeding is good for them and their baby. And what we want to do is help them get to the place that they can say, if they say they want to breastfeed their baby for 6 months or a year, and the American Academy of Pediatrics recommends exclusive breastfeeding for 6 months and continued breastfeeding for at least a year, and then as long as the parent and child want to continue after that. And the WHO recommends for up to 2 years.
Okay.
Obviously, a child starts to eat other foods after 6 months, so they're not necessarily exclusively breastfeeding after 6 months. So most of our families know that message, and they want to do that. And what we need to do is help them get there. And so successful breastfeeding to me is helping a parent meet the goal that they want for their baby. And it's not my definition of success, it's their definition of success. And I really think one of the things all of us who are trying to help breastfeeding families need to do is to better be able to have a sort of shared decision-making, empowering conversation, just like we do with any motivational interviewing, behavior change that we do in other areas of medicine. This is a perfect place to help have that kind of conversation. And that's not been the way that breastfeeding support has traditionally been offered. We've done the, you need to do this, and I know better than you because I'm the expert. And we need to kind of reframe that as the family is the expert about themselves and their child. We just need to help them have the information to make the choices that are going to work for them.
I remember when I was talking with women about breast milk in particular, that, you know, some of the things that I remember saying was that, gee, it's exactly the right composition. There's no better kind of combination of protein and carbohydrate and fat than is breast milk. It's the right temperature. It's sterile. You know, it's sort of like you've got this ready to go. I mean, it's just like, I don't know, going to a fast food place, except that, you know, it's mom. Well, how has the REACH, what are the things that the REACH program is doing to address the breastfeeding needs in the community?
Sara was mentioning about all the benefits that we have for our babies and for the mother when it comes about breastfeeding. And when we talk about health equity, it's about creating the resources in order for our families to be able to achieve the fullest potential of health. So we are working with different partners. We believe a lot about mission-driven organizations, and this is what we need, intentional people to create resources in order to support our families. And we are working with different organizations, and for example, working with Worcester Healthy Baby Collaborative. We have gotten a lot of connection with our community. We have created partnership with other organizations. We understand even better what is happening inside the healthcare centers. So we created focus groups. And focus groups is telling us from lived experiences. We interviewed around 29 mothers. We work with the Latino Education Institute. It is a program under Worcester State University. And during these focus groups, what we found, that all these mothers have the intention of exclusively breastfeed their children. But they didn't have the knowledge here. And you were talking about how handy is breast milk. But it's not easy. It's natural, but it's not easy. So mothers need to have the knowledge, the resources, the support. It can be family. It can be through healthcare providers. But they need the support, and sometimes it's about the education that we can provide for them to make the proper decision, because we already know that they have the intention. But in order for them to make those decisions, we need to have those conversations to inform them about the benefit, about situations that they may be facing that can prevent them from breastfeeding the children. So we are working with different partnering agencies. Also, we are working with a company, Ydalia Care. They are supporting our community through trainings. Last year, we trained 14 individuals from our community in doulas and breastfeeding services, and this year we are doing it again. So now in June, we are going to have another cohort. We are looking for another 15 persons committed to support this cause, willing to work in the field. And we are looking for multicultural persons. If they are Latina, even better because
Right.
we are working with the Latinx population.
Let me just pause for a minute and say to our audience that you're listening to Health Matters. This is a show tonight about breastfeeding and supporting equity in our community with this important intervention to help babies be healthy. I'm joined by Sara Shields to my far right, who is a physician, a family doctor, and head of the Worcester Healthy Baby Collaborative, and Ydalia Heimann, who is works for the City of Worcester Division of Public Health and is the REACH program manager. I know a little bit about doulas, and I thought that I understood that doulas were people who sort of supported folks in pregnancy, were there as part of the birth process, but now you're extending that, that relationship to include the support of, you know, how do we get going with the breastfeeding and how do we make adjustments as the needs of the baby change, which may or may not be something that the mom is anticipating or necessarily happy about. But that doula program is now going to extend, is that correct?
Yeah, we are extending the services through doulas because when a doula individual is working with a family, they have information, they have knowledge, they have resources that they can provide to the family. So if they have also breastfeeding trainings, they will be able to further support this family in order to address what we are talking about today, health equity.
Wonderful. Maybe you could describe some of the resources, examples of some of the resources that are available to Latino families that you want people in our community to know about.
Okay.
Could I just say one thing first?
Certainly,
the other
absolutely.
thing that the REACH grant has allowed us to do is really try to train some community members to become certified lactation counselors, which is an entry-level certified breastfeeding support person, basically. So it's a 40-hour training and an exam, and we've tried to select people from the community who either have an interest in breastfeeding or are working with breastfeeding populations to take this training. So
But this is different than a doula.
This is different than a doula, and this is a specific breastfeeding support person called a CLC, or a certified lactation counselor.
And how would that person get connected to a mom who could use their services?
Well, that's a really good question, because one of the things that's very limited all over the country and for anyone, regardless of their race or ethnicity or language, is that breastfeeding support services are not very well funded. If you have private insurance or are able to privately pay, then you can find what's called a IBCLC, or International Board Certified Lactation Consultant, and pay for them yourself. But that's not available to many of our families. And most insurance companies do not pay for the services of CLCs. So we've tried to train people that already have some role in the community. For instance, we've trained a couple nurses, we've trained a pharmacist, we've trained people who work for early intervention programs. We do have a couple of at-home moms who are interested in this, and we're trying to see it as an entry level to get them interested in this work and potentially later training to be a doula or a midwife or something like that.
You know, when I think about professionals who are available to help people get better and do better, you know, physical therapy, occupational therapy, speech therapy, stuff like that, all of those services seem to be paid for. But here we've got a intervention that is as natural as can be, but clearly people do better if they have support, and we have professionals who can do that, yet making that connection that there are still some barriers. And is this REACH grant, is that able to address some of that access?
It's been funding the training for this, and then we're working on, the REACH grant has also funded us being able to hire at least one of these people to do a pilot to expand services for a program we have called the Baby Cafe, which is also supported by the REACH program.
So the Baby Cafe, tell our listeners about that.
Okay. Baby Cafe is a group sessions that we have a family health center. It can happen in different locations, but we have it right now with the Family Health Center. And during those meetings, what they do is that one of the CLC or a peer counselors meet with mothers, and they talk about many different topics related to breastfeeding, but they can go even beyond. We talk a lot about the social determinants of health.
Oh.
And there are many issues that families are facing that are not just related to breastfeeding, but that can affect the process. So we can also create some information and referrals and provide them resources in order to continue moving forward to another level in their health.
I see. So perhaps housing security might be part of that, or certainly I would think food security
Yes.
would be that. There may be others that are there things that you've come up against that you say, gee, you know, here are more opportunities? Because the baby cafes, it sounds, I mean, I think about, you know, going to a coffee shop or something like that, but, you know, you framed it in a way that just makes it kind of fun and accessible, I would think.
Definitely.
Are there other resources that are part of this grant that you would like breastfeeding moms to know about, particularly in the Latina community?
Yeah, we talk about doula services, and I would like to expand a little bit more about doula services, because what we are doing right now is to prepare the workforce, because through Mass Health, we are going to be able to receive some reimbursement services, those that will be providing those services. So we are working a little bit ahead of the game. So we are preparing the workforce for UMass and any other organization to be able to hire these persons to work for them and to be able to address these gaps that we have in the community of Worcester.
So this sounds like, you know, you're helping the third-party payers see the wisdom of investing, you know, frankly, a smaller amount of money at the outset to help promote breastfeeding so that you then get a better outcomes for your newborns and infants as they sort of get into toddlerhood.
Yeah,
Yes.
and the Baby Cafe, although it's located at the Family Health Center, is open to anyone who wants to come. It's been mostly virtual through the pandemic, but we do have a couple in-person sessions now. And I don't know if it's time to put up the QR code that we have. It has a link to the flyer in multiple languages that describes when the Baby Cafe services are available.
I'm eager, so I'm going to ask that we put up that QR code. There it is on your screen, and we'll leave it up there now for a bit. And I hope you'll get out your smartphones and we'll just, you know, push the button that says, you know, QR reader or whatever, because that will provide you with an immediate link to this resource. And I was absolutely astounded. There are 9 different versions of this resource available in English, which is the one I looked at, but then Arabic, Dari, Haitian Creole, Pashto, Portuguese, Spanish, Twi, and Vietnamese. And when I think about our community of Worcester and its diversity, this, I think, does a pretty good job covering lots of folks, but probably not everybody. But what a remarkable effort, and that's something that the REACH grant, I guess, has helped.
Yes, so we were able
produce.
to check which one are the most spoken language here in the city of Worcester, and we found that those 9 languages are the more spoken, so we decided to make this translation. If we see that there is a need to continue translating into another languages, we will do it, because we are committed to address the health equity in the community of Worcester.
Right. Are there other resources? For instance, when I glance at this, I saw the 2 major hospitals that are here in Worcester, and I love the phrase that there's a lactation warm line. You know, it's not a hotline in the sense that somebody isn't, you know, picking it up right that minute, but you can call and you will get, you have an opportunity to leave a voicemail, and you'll have a lactation specialist will actually return your call and talk with you about what needs you might have and try to address them. Is that right?
Yes.
Yep, both hospitals have that service available, and they also run breastfeeding, at least at UMass, there's a breastfeeding support group that has been mostly online during the pandemic, but I think also planning to get that back to being in person when possible.
I am sort of thinking about other resources, and I know that sometimes a breast pump is something that's helpful to women to be able to harvest breast milk, and at times when they are not with their babies, so that their baby can have breast milk, at other times. Is that something that is possible through these resources, by any chance, getting help with getting
a breast pump actually is paid for by insurance, including Mass Health, and so that's not an issue for equity because everyone has access to those. So the ACA created laws around breast pump and lactation services. That's just not the lactation consultant services aren't equitably distributed, but the breast pumps are. So almost everyone gets one in the hospital, if not prenatally. So
okay, all right.
So we haven't had to work on that issue for specifically. The other resource that's available in Worcester, and many of Worcester's residents qualify for the program Women, Infant, and Children Supplemental Nutrition Program, and also known as WIC. And WIC has breastfeeding peer counselors. So every breastfeeding person who's enrolled in WIC has access to those peer counselors. And there's a pilot program from the state right now to offer WIC offices that don't have their own IBCLC, which Worcester does not, access to one. We have a total of 10 hours a week of those services for all of central Massachusetts. So we have to kind of decide which people are most at risk and in need of those services. But the peer counselors have had a lot of breastfeeding training, and at least 2 of them now have had this other certified lactation counselor training. And so they staff the baby cafe, and they are also available for support at the WIC offices. And we're working on ways to, if we know, for example, that a premature baby is being discharged over the weekend, we can help get that information to the WIC peer counselor to call the IBCLC, so we don't have to have a delay in getting the family immediate outpatient services that they can have access to.
Well, as you can hear, we're coming to the end of the show, and I'm so sorry. Well, no, in that we've had a great opportunity to share resources. You saw that QR code. Is there a number to call right up quick?
It's through the QR code, so there's different phone numbers to call.
So I want to thank you all for joining us, and I want to thank Frank Rocco, our engineer, and we'll see you again next time on Health Matters.